Let's talk NSAID alternatives for pain relief and inflammation. Okay, this is a response to questions I got from yesterday's post. So first and foremost, you want to be looking for the root cause of the pain to try to resolve or diminish that pain source as much as possible. Of course, this will take some detective work, but I want you to consider food sensitivities as a big culprit, okay? But that's not the topic of today's post, but it is the most important and first step. Okay, so secondly, we must remember that medications are considered by the body as a foreign substance that must be detoxified. So not only does this pull resources, these medications are not safe enough for daily use. They should be taken only when absolutely necessary. Now, mild aches and pains can often be helped with stretching, exercise, massage, arnica, Epsom salt baths, and low fever shouldn't be treated at all unless there is some special medical circumstance your doctor has advised you about. Okay, fevers are our body's reaction to an invader. Our immune system makes the temperature go up to be inhospitable for the virus to flourish. Okay, this helps healing come quicker. So just make sure that you're staying hydrated. Okay, so taking NSAIDs is not without risk. You've got aspirin, ibuprofen, which is Advil, and naproxen, which is Aleve, that can damage the gastrointestinal tract, which is a risk factor to leaky gut, also called enhanced intestinal permeability. Okay, Tylenol, on the other hand, can damage the liver as well as hinder the production of glutathione, which is what I talked about in yesterday's post. Okay, and this damage can occur even at regular dosage levels for just 2 weeks. There was a study done that showed liver enzymes were elevated in over 1/3 of the patients over just 2 weeks of normal usage. Okay? So natural alternatives. I've already mentioned a few options for minor aches and pains. And please understand, I'm not saying you should never take these over-the-counter medications. We just need to be more aware of what we're taking, how often, and the possible damage they could cause so we can balance the risk versus reward here. Okay, and use natural alternatives that don't have those side effects whenever we can. Okay, I'll talk about 3 options. Number 1, turmeric has the active polyphenol component called curcumin. Now, turmeric has, as a whole, has high oxalates, and that can contribute to kidney stones in very high doses. Okay, this is more than a normal person would consume on a regular basis, but just heads up on that. Okay, but when we pull the curcumin out of the turmeric and just consume that, it is a very effective pain reliever that's actually been used in India and Ayurvedic medicine for centuries. Okay, there are a lot of studies supporting it being a powerful antioxidant. It's antimicrobial, it protects the brain, it assists in detoxification, and is an anti-inflammatory and pain reliever. Okay, all without those side effects of the over-the-counter medications. Okay, you want to buy a potent product. Curcumin is not well absorbed in the bloodstream, so this is why some people may say it did nothing for me. Okay, so to assure maximum effect, we want to purchase curcumin that's bound to a fat molecule. This allows it to be absorbed well into the bloodstream. Okay, that phytosome product is called Meriva, and it's about 10 times more bioavailable than just plain curcumin. Meriva is a trade name, not a brand name, so you will find many different companies that sell Meriva curcumin. My personal preference is the Thorne brand that sells it without extra binders and garbage. If you've read my ebook on selecting supplements, you'll know what I'm talking about there. The recommended dosage is 500 milligrams Meriva curcumin twice a day for pain and inflammation, then allowing that to build up in the body for 5 days before increasing it, if necessary, to 1,000 milligrams twice a day, taken with food. And now I had a comment on yesterday's post, what if you're allergic to turmeric? In that case, I would suggest looking at these next two options. Okay, so number 2 is bromelain, and that is found in pineapple as well as in supplement form, and it reduces inflammation. Now, studies have shown that it's particularly useful for joint pain. Okay, it also helps to increase the absorption of quercetin if you happen to be taking that natural antihistamine for allergy or asthma. Okay, with bromelain, it's recommended to start with 250 to 500 milligrams of bromelain twice a day. It needs to be taken on an empty stomach at least 1 hour before consuming food. If you have hypertension, you'll want to start on the low end of the dosage, and it is not recommended to be taken without direct doctor supervision if you're taking blood thinners, as it also acts as a blood thinner. You may have a doctor that adjusts your dose so that they could work well together, but check that out. Okay, number 3 is boswellia, and it is also an excellent anti-inflammatory, and Pure Encapsulations brand is a good recommendation. Now, you can find any of these products that I've been talking about on Amazon, but just make sure you're purchasing through the brand's Amazon store and not from a third-party seller who could be selling a fake product, okay? And to round the conversation out, it's always recommended to make sure that you're getting a good amount of omega-3s as well. Ideally, 1,500 milligrams twice a day if you're dealing with chronic pain and inflammation. Metagenics and Nordic Naturals are 2 brands that I like there, okay? Also focus on proper hydration and make sure your magnesium levels are optimal, okay, as both of these are critical for optimal cellular and muscle function and health, okay? If you want to learn more about that, check out my mini course, CBC Decoded, to learn how to understand your annual blood work from a functional medicine perspective, to help improve your overall health and longevity. And I hope that helps. Have a great day.